Hello, I'm Dr. Dammel.
And I'm Rachel.
And for the last 4 years, we've been helping our patients in northern Kentucky find the relief they need from acute and chronic pain.
If you suffer with neck pain or shoulder pain,
migraine headaches or carpal tunnel syndrome,
low back pain and sciatica,
osteoarthritis of the knee, hip, or spine, then give our office a call.
If you are in pain and wondering if you should see a neurologist, an MD, a chiropractor, a rehab therapist, or massage therapist, we can help. We have all of these professionals in our clinic working together to help diagnose and determine the right treatment plan for you.
We specialize in the most advanced, cutting-edge treatment options in a medically integrated facility to help you get out of pain fast and effectively. For a free consultation, call 859-283-2475.
And we look forward to helping you live a life free of pain.
Here are a few stories from some of our patients.
Hi, I'm Tiffany, and I've been coming to Dr. Dammel's office now for approximately 2 weeks. And when I first started coming here, it was because I had upper back problems along with a lot of stiffness in my neck and very consistent headaches, comparable to migraines. So when I came here, Dr. Dammel recommended massage, adjustments, and upper back strengthening workouts. And I feel like a completely different person. I haven't had headaches in weeks. I just feel so much more loose and relaxed, and I don't experience the same stiffness in my neck as I did before. I highly recommend the practice to anybody who's experiencing pain just like mine.
Hi, my name's David, and I've been a patient here for a while. I was a cripple. I couldn't move, and it was the result, I guess, of having a very active life when I was younger. And I used to have pain and numbness a lot, and medical doctors told me this and they told me that, but one day I couldn't stand the pain anymore because I couldn't move, I couldn't walk, I couldn't do anything. I was basically crippled. And I went to my local doctor and he said, "You better go get an MRI." I went, "Oh, okay." No one ever said that. And so I got an MRI, and he says, "You got herniated discs." And I went, "Wow, well, what's that?" You know, I didn't even know. And I, at the time, could not survive without narcotics, heavy narcotics. I actually couldn't live. And I don't like those narcotics because they really have rough side effects, but it was the only way I could live. And he had suggested surgery because the disc was so badly herniated. It turned out later, after a neurologist studied the MRI, I had 8 herniated discs. So my body had been very busy over the years degrading. And anyway, a friend of mine who was a chiropractor told me about decompression therapy. So I found Dr. Dammel here, and he had a bed, like a decompression bed, and it was amazing. Like, you get relief immediately, and it's not a quick cycle. It's not like with the level of, I guess, degradation that I had. I'm nearly 60. You know, it doesn't take 5 minutes, it doesn't take 1 treatment or 2 treatments, you know, but it's a gradient scale. You go out the same way you came in, and if you don't rehabilitate what you've allowed to degrade over, for me, it was probably 40 or 50 years of, you know, thorough beating of my own body through football, dirt bike racing, you name it. And I don't take narcotics anymore. I don't have to sort of go crazy with pain, which is really nice because it ruins your life, as you probably already know for anyone who's watching this and knows about pain. It makes you an outcast because you can't do anything anyone else does. So I've come a long way, and surgery isn't necessarily an answer to such a problem, because if you don't rehabilitate by doing decompression, which gradiently restructures the muscles, the tendons, the bones, everything back to what it was, if you don't do that, well, it's going to come back again. So you can go in surgery and shave off the disc that's protruded from the vertebrae that's now impinging on your nerve. But you're still going to have it. It's still going to come back again because the body's deformed, the spine's deformed, and actually what it does is decompression actually rehabilitates your body back to what it was when you were really young. And to me, it's the secret of getting old, because the only reason you get old is your body degenerates and the organs and the nervous system doesn't generate the correct amount of correct enzymes and the correct endocrine system. It's all out of whack because it's deformed, and what decompression does is put it back to where it was, and it basically saved my life physically. I'm sure I'd be dead in another 5 years if I didn't do it, just because everything was degrading. All my organs were degrading and everything was degrading, and the nervous system now has a chance to operate properly. So it's I highly recommend Northern Kentucky Pain Relief for anyone who might have back pain. Definitely get it checked out, because it's usually something like what I just described in a lesser or greater level of degradation.
My name is Michelle, and I've been a patient here for about two and a half months. I have been in chiropractic therapy since 1998, so when I came in with a friend of mine, I saw how they did things here and I was really interested, so I started treatment, and I have been much improved. The difference between this type of facility and traditional chiropractic places is that they've got different practitioners to treat you all at the same time. So you've got your massage therapist, you've got your neurologist, chiropractors, rehab specialists, and a nurse practitioner. And all of those people are treating you together. They're working as a team to make you feel better and to stay well, so you don't have to keep going back and being in chiropractic therapy for years like I have been. One of the things that I really appreciate the most is that the doctors listen. Probably about 2 weeks ago, I asked Dr. Damel if we could just take a look at my x-rays again, because I wasn't sure about something else that was going on. And I know my body pretty well, and he got that x-ray right out, and we started talking about it. And that's one of the great things about this facility, is that for someone like me who knows my body, I can say, look, I think this is going on, and they'll listen, and they're sensitive to that. But even if you don't really know what's going on, they have the training and ability to help you figure that out and will treat you accordingly. So I think I've just got a few more weeks left of therapy, and I should be hopefully in what we call the maintenance stage and on my way to recovery.
My name is Toma. I've been coming here for 3 weeks now. Within the first week, I've been feeling probably 70%, 80% better. I came out here first because I had neck problems and back problems. Standing on concrete for 20 years at work does it take a toll for a person. And I come in here, they take care of me. Like I said, I feel so much better. I've recommended this place to my family and friends, my co-workers especially, and I would recommend this to anybody.